Medical Dilemma.
Welcome back to Medical Dilemma. Again, we'd like to say thank you to our major sponsors, St. Clair's Medical Center and LifeQuest Training and Consultancy Corporation. Now, let's start from where we left off with Attorney Sara earlier. So, that situation where
you
know,
got, you were
I had this
liable.
unfortunate experience with a drunk motorcycle driver.
Matagal na ba
Medyo
yan?
matagal na, I
Ay,
think.
nagko-confess
Sa
lang siya.
Pilipinas
10,
ba yan?
15 years ago pa. Ganun. Yeah, here in the Philippines it
Yeah,
happened.
he stayed for quite some time abroad kaya
Yes,
siguro
yes.
nabigla.
So, it was more than 15 years
Although I
ago.
have to commend you that you said you brought the patient, I mean, the
Yes, because
motorcycle driver immediately to
that
the
time,
hospital.
I saw the driver was already injured and bleeding, syempre. So, I rushed the patient to the hospital. But I was not able to establish the scene of the accident anymore. And we didn't have digital cameras that time. Yeah.
So the fact that you brought the patient to the hospital, they should have also smelled the alcoholic breath.
It was
and that
very
would be
strong. Everybody
against
that
him,
handled the driver commented, this guy is totally drunk.
Therefore, he's guilty and he should be.
Yeah,
I mean,
should really
although he,
be.
he caused injuries.
Yeah,
to
he's
himself.
guilty for the accident. Maybe I can shoulder the expenses of the injuries.
Anyway,
but
if
to
you
say
have a
that I am the one
comprehensive-
who's guilty,
Anyway,
it
if you have a
really bothers
comprehensive,
me.
Insurance for the car,
Yes, yes.
probably
Fortunately,
they,
there was
they will
a
be the one to
insurance
answer
for the
for
car.
it. Oo.
Yeah, in common law, we call it the Good Samaritan rule. Kasi in the Bible, the Good Samaritan who helped the whoever was lying on the
But he
road
was the one
was
who
the
caused
one
the
who
accident.
was the one who got punished. Oh, yeah, okay. It's hard,
Oh,
as you said, it's
anyway,
hard to establish the scene of the crime. Although I say I have to commend you kasi ang tendency dito is hit and run, which has a stiffer penalty, talaga reclusion perpetua, especially if it results in homicide, no. But I mean, assuming your case went to court.
yes, assuming it went
yes.
to court,
And the
who
judge
would have a
has to-
stronger case?
I believe you'll have a stronger case kasi nga, well, aside from the fact that, as you said, he's obviously drunk. I mean, it's beyond
Hospital
probable
records
cause.
will
Yeah,
show
and
that.
Yeah, the
hospital
hospital
records
records
will show that he was drunk and therefore caused the accident. He was the one who was
Impaired.
Yes,
Impaired,
and then
all
the
the
traffic
senses,
offense,
no?
yes, is initiated by him. In other words, kasi you were in the right of way, you were turning in the proper lane, etc.
I
But
think the presumption should be there, no? If somebody is
Yes.
drunk, the presumption is siya may fault.
may fault, yes. It's same with driving without
You're
a
not supposed
license.
to drive,
Diba? You're
diba?
not
Yes.
supposed to drive. So if you're
If
driving
you're
without a
under
license or you're
alcohol.
driving drunk, then the
Oo.
presumption of guilt should be on that person who is under the influence of alcohol. So that's true. Although kasi dito ang immediate issue, I guess the immediate dilemma is who shoulders the treatment. So
Yes.
that's why they
Whoever
have
has the money.
Oh, that's why.
Whoever has the money.
Yun ang guilty. oh.
Going back to Dan, no? Who shoulders the treatment? You know, most patients have
Yes.
HMOs, right? But I
Right.
think when it comes
It
to
will not be
accidents,
covered by
they
the
will not
HMO
cover
for-
it.
usually
Kaya
for-
maghalito yung pasyente sa'yo. Sabi mo, please do not tell that this is due to a
Yeah, of
vehicular
course we
accident.
cannot do that, right? Because you have to put in the record.
okay.
Actually, a lot of people ask us to do that. Don't say na lang nakainom ako. So, but of course we can't do that because that's part of the history and the record is a legal document. I mean, the medical record is an official
Yes.
document.
Yeah.
So we really have to put that there. So a lot of times the HMOs or insurance will not cover. Of course, it's a reckless act, drinking and driving, diba? So they won't cover that because that's practically self-inflicted. You know?
But the nice thing with the new law is that it is required now to have a blood alcohol test,
Yes.
which at present hospitals do not do. They just
Yes.
smell, and if it's positive, they just put
They
their
put
positive.
physical findings.
But
on
just because you don't smell doesn't mean you didn't
Yes.
take anything before that.
And then you have an objective. If you have a test, you have an objective evidence.
Yes, and so that will be with the.
So actually, in answer to your
test.
question, most of the
Yes.
time, the one who has more money is the one
Usually
who
ends
ends
up
up
paying.
paying. Also,
Injured siya eh. Injured yung isa.
Yeah, injured kasi yung
syempre.
isa. No? So, I mean, what bothers me most is, sometimes the children, the mothers let their children run across and then, so syempre, bata. So, syempre, nakakaawa, di ba? Bata, and then wala siyang pera, and then the mother's there crying, getting mad at the driver, no? So, a lot of times, compassionate also. I want to make sure that the child is okay. But also, like attorney was saying, no, in the court, of course, you have to establish all of that. The person, all of they're busy, they're working, so mapiperwisyo ka pa, to go to several court hearings and all of that, no? So, usually, they end up just settling that day. No? So, I take care of whatever. Minsan, may pocket money pa para lang to say na okay na tayo, no? Kasi I've seen it happen also very often. If you don't fix it properly on the day, the next week they come back, masakit ang ulo ko, may ano pa rin ako, medyo yung neck. So they have all of
Yes,
these.
that leads me to my next question. Attorney, is there some legal instrument that we can sign with such people
Yes.
para lang hindi na sila bumalik?
Yeah.
Parang quit claim.
Oh, yeah. It's exactly what it is, a quit claim and waiver. So,
Okay.
it's
And that
not,
will hold.
Yeah, that will hold. It's not an admission of guilt on your part, just that they can no longer run after you for any damages after you've paid for the hospitalization. So, you can ask them
Can
to
this
sign.
be an informal document? Let's say, you
Agreement
and I
lang.
just sign,
Oo,
or
yeah.
does it need to be
Well,
notarized? Because we get that question also a lot.
Pwedeng naman informal lang yun.
pwedeng not
It can
notarized.
be an
as,
informal
uh,
document.
Oo, but of course, you run more risk with that. Pero notarization na hindi naman kailangan yun eh.
So it can just be, a handwritten.
handwritten
yes.
note.
So,
It
yes.
can
So
be.
commonly, that's what happens. I'll shoulder all your expenses. I'll give you some, I buy your outpatient medications. Just sign this form that says that, you have no further claims. Yeah.
Oo, wala na.
Para at
Waiving
least
everything.
they're done on that day.
Yeah.
So actually, we get a lot of that. Just last week, I had one like that.
Now, I'd like to go back to the earlier scenario where a patient, an ER patient, has to undergo more extensive procedures, but the family cannot afford. And so the decision is lipat na lang ng hospital, maybe a government hospital. The responsibility of the first hospital, when does it end?
Okay. Well, I mean, obviously, regardless of ability to pay, we have the responsibility to treat the patient for life-saving measures, no? So once you stabilize, then we discuss transferring, no? So in the medical profession, we have what we call endorsements, no, or
Yes.
handing over a patient, no. So it's a formal and objective act na I am passing the care of the patient on to you. No? So
To your colleague in charge.
no,
Is that
or
the
to another
person?
institution,
To
or
another
something like
institution.
that, or even to the ambulance that will take the patient there. No, so there is an act of endorsement where I say, this is what happened. These are my findings. These are the results. This is the medicine I gave. My impression, etc. I'm now passing the care on to you. No? So that has to be a clear act, and then the responsibility now goes to the next healthcare provider. And then they arrive at the hospital, and then the ambulance again passes the patient off to the next institution. So ideally, this should be done all the time when a patient transfers care. Although unfortunately, sometimes some other healthcare institutions don't do the courtesy of endorsing properly, and the people just show up at your doorstep.
Sometimes they do that sa government because they're afraid they will be turned down.
Yes.
So for example, mga anak na, naghihintay mo na sila pag alam nilang malapit ng mga anak, then
Emergency. Go to the-
Emergency na. So
So they don't bother to call because they will be
Yes.
turned down. They're sasabihin, we have no incubator, we have no beds, no,
correct.
something like that.
Although that's
This
a
is in the
dangerous,
government hospital.
Yes, private, well, sometimes
also
they
only
accept, no?
private, sometimes.
The same.
Yeah.
But there is a law that requires that you can, indigent patients, you can transfer them, provided they are stable when transferred.
And how
You
do
have
we
to stabilize
define
first.
stable?
Well, I guess so that the doctor that sees them, usually the emergency physician, will be the one to determine what I need to do in order to stabilize the patient. No, I think we were discussing a little bit earlier about admission. No, where
Yes.
there's a law that the hospital must not deny admission to a patient or demand a down payment. No? So I think just to clarify, when a hospital says admission, they mean I'll put you in the room. No,
Yes.
but the law I think covers the treatment. No?
Only
so the
treatment.
hospital must treat the patient, but it doesn't mean that you have to be put into
Put
a
in a
room,
room.
right? So what we often do in the ER, and actually to be fair, hospitals, almost all hospitals, usually take a big hit in terms of receivables or bad
Correct.
accounts because an emergency comes in
You can't refuse.
without the checking capacity to pay, we treat. And then they end up with a bill, no? If they,
Yes.
and then after stabilizing, then we pass to a government hospital, but they're left with this bill, no? And hospitals absorb a lot of that every year, it's very common.
That's true.
Yeah.
That's
The
true.
family of
Yes.
Sunny owns
Yes, I
a
see
very
that also.
reliable
Yeah,
hospital
And
here in
that's
Makati.
part of being a hospital. You absorb those
Yes.
expenses.
Right.
Yeah.
That's right.
But I think the best proof that you are stable would be the vital signs,
Yes,
right?
correct.
If they're at least stable.
So vital signs.
Yeah, and back to
Vital
what
signs.
Sunny was saying, no, whatever happens while the patient is in my care is my responsibility.
Okay.
I have to be able to transfer this patient to you, and we document at time of transfer the vital signs are stable. This is the condition of the patient. That's all documented in a document that I pass to the next person. And then they receive and do their own documentation. Is should match. Then we see where the care, what care was done.
Yes.
It's also possible actually that the first provider can have neglected to do certain procedures, and the sequelae happens in the other hospitals. Like for example, I didn't assess the brain.
Yes.
So he looks okay now. Yun pala, may bleeding sa brain. Pagdating dun sa kabilang hospital, yun na, crash na siya because
okay.
so sometimes that happens. That's also on the records.
Yeah.
That the first hospital did not perform the test.
Well, it depends. It depends upon the capacity of that hospital.
Yes, correct.
Sometimes they are only secondary or primary hospitals, and they do not have the proper equipment to do that. No?
Yes.
But supposing you need to have an ambulance, no, and they cannot afford it, the patient's relatives turn it down. So what do? Will you allow them to go by jeep or taxi?
Well,
or
that one will
whatever?
be what we call leaving against medical advice. No, so again, they have to sign this waiver that says we are leaving against medical advice. That's never the ideal situation. No, unfortunately, sometimes it turns out to be the most cost-effective or practical thing to do. Sometimes, because if they can make it to the hospital, no. So, but that's never advisable. Fortunately, I think again in the past few years, no, there's been a rise in the provision of services, pre-hospital services
Outsourcing,
like ambulance and
like
all
that,
no?
outsourcing
So
of-
some barangays have their own ambulance. So we've
Yeah,
had times where the
barangays.
patient calls their barangay and says, "I need to transfer to hospital. Can you send the ambulance to pick me up?" No. So at least there are options, which is
Okay.
And then there are always private ambulances, of course, which you have to pay for, no? Varying levels of as price levels. But then at least sometimes there's the government service ones, or the Red Cross also has ambulances. So depends. Yun nga lang, you're on your own to source. You have to be creative. No? Kasi yun yung
Yes,
maparaan,
yes.
no?
And sometimes relatives blame, no? When you have a poor outcome, they blame the institution, but sometimes it's beyond your control. no?
Yes,
These
correct.
are things. That's why you should always pray that you never get involved in such.
Yes, and that's why
Such things,
documentation is very
accidents.
important. You document all of the findings, vital signs, tests that were done, even the history. What you told me at the time, I'll write it down.
Yeah.
So if you withheld something, it's not in my record, and that's why I did not, do that test. no?
Pursue the
But
test.
I think relatives and patients are getting more and more aware now, no, of their rights and of what should have been done, etc. So well, it's good that there's more awareness now and they're more knowledgeable.
So if one hospital transfers a patient to another hospital
Okay.
and it uses its own ambulance, even during that time of transport,
Yes.
that hospital is still responsible for
Yes,
that
correct.
patient. Even though all the documentation has been done and
Yes.
The
a
original
representative
hospital, you
of
mean?
the yes, the
Original hospital, using what ambulance?
Their own
Their
hospital.
own
Their own
hospital. Yeah,
ambulance,
because the
yes.
ambulance is like an extension of the
Yes,
hospital.
until such time that
Yes,
they turn over
until to the other
the receiving
one.
hospital.
Yes.
I see.
So
Okay.
depende rin.
Yeah, that's also a common challenge we face, no?
Another issue would be the deposit, no? No deposit law that is connected with that, no?
Yes.
That you're not supposed to ask a deposit initially.
Right.
You have to first treat, give first
Correct.
aid, do anything. Then, saka mo na lang hihingin ng deposit if they decide to be admitted in that hospital.
Yes.
If not, then you don't get, and they just transfer, they just pay their bills.
Yes,
whatever,
correct. And
no?
that's a common misconception, actually. So in the ER, we always try to make it clear to the patient, we will do the treatment that's needed in order to save the life or improve the outcome of the patient. The deposit is only required if you do continuing care in our hospital. But actually, a lot of times, even the patient or relatives themselves will decline further treatment in the hospital. That's very expensive. They'll say, dun na lang sa government hospital para mas mura. So sometimes they'll they'll decline. So in that instance, they will sign what we call a refusal. I refuse to undergo this procedure for whatever reason, even if the reason is financial constraints. Diba? So in that way, the hospital is not liable anymore, right?
What if, doctor, it's an emergency really, life-saving, a victim of gunshot wounds or
Yes.
stab wounds, and then they're losing a lot of blood. So what do you do? And there are no
Definitely we treat-
relatives around.
Yeah, definitely we treat to whatever extent is needed. If we're talking about saving life or limb, definitely we treat. No, in some hospitals have the good fortune to have the facilities and capabilities to do everything needed. Unfortunately, that was also the hospital that will have to shoulder the cost of those things if just in case happens that the relatives or the patient has no capacity to pay. But definitely we do treat. I practice also in a government hospital as well as a private hospital. No? And in both cases, of course, the staff will always have the intention of doing the best that they can. No? But of course, some government hospitals are limited in resources. So still they do what you can, and then you transfer up to a higher capacity hospital if needed.
Doc, can you clarify just briefly this practice of triage? Because there's another experience I had. Two emergency cases arrive at the same time. Of course, the relatives are very emotional. Inuna yung isa. And then nagreklamo yung second case kasi sabi nila, bakit yung inuna yun? Emergency rin naman kami. Ganon.
Yes, yes.
So how does it really go?
Well, triaging in concept, it's really just a matter of classifying cases and putting them into where they should be treated more urgently.
Yes.
So there are different criteria depending on the hospital itself. So triage is institution specific. For example,
okay.
in one hospital I work in, there are levels of urgency of care. There's the critical area, so those who are may die anytime are brought there. Then there's the acute area, which they need to be seen and assessed, very soon. And then there's the primary care or ambulatory area, which non-life threatening. So of course, the critical people get seen right away because minutes will matter. And for those who are, we're not saying that you're not uncomfortable, but your life is not in danger, So actually, you should be happy that you're not in the critical area. You'd rather not be in the critical area than the critical area. In other institutions naman, the treatment is departmentalized. So there are surgeons, pediatricians, OB gynecologists. So they're triaged or directed to the appropriate service. It depends on where you are and what the facilities and capabilities of the hospital are. Also, there are things, especially let's say in the U.S., it's a little more developed, no?
Yes.
So let's say the ambulance picks up a patient, possible heart attack. They will bring the patient to a hospital that has the capability to do angiography, even if the nearest hospital there's a hospital that's nearer, but has less capacity, they will bypass and go directly in order to quicken the process. So it's a matrix of many different possibilities.
Sa States pwede yun, but I think in the Philippine scenario, parang hindi pa
Yeah,
pwede
it's not so
ganon,
applicable yet. No?
Yeah, they might accuse you of
Yeah.
causing delay.
We don't have a good network yet kasi
Yeah, wala
of,
pang good network.
the healthcare network is not unified. It's still very
Although I think the
compartmentalized.
DOH is trying to go to that. No?
Yes, definitely.
Properly working.
Okay, well, unfortunately, we've reached the end of our show. I know we still have a lot to discuss, but we have to say goodbye now. So, Attorney Sara, a few words before we part.
Oh, okay. I think we learned from today's episode of Medical Dilemma that in case of collision, banggaan po yan. So yung mga pasyente dyan, you cannot ask the doctor or the hospital to not write down that you're not drunk because hospitals are now mandated to test for alcohol concentration in your blood levels whenever there is a collision, whether or not may nasaktan. So that's the new law.
Dr. Luchangco?
Well, actually,
final
from the
words?
point of view of the emergency room doctors, I think it's good that there's a lot more awareness. Patients are aware of their rights and all of that, and then the laws. I think we just always have to remember that the staff of the hospital is always going to do the best they can. So no one's trying to treat you badly or whatever. It's just that
Just make money out
there's
of you.
resources and other considerations, but we'll always try to do the best that we can. So we just ask that the patients try to see it, understand that.
Okay, thank you. Dr. Sanchez?
I think people should be aware of that there are such things as accidents, no? And therefore, they should try to avoid situations where there is a risk to their life or limb. Like, for example, you walk through a very dark street and you might be mugged or something like that. So I think people should be aware also where they can go, safe places, among
Actually,
others.
prevention is really the best way.
Yes.
Okay, thank you so much, everybody.
Thank you.
Speed is crucial in handling most emergency room cases, thus making ethical medical practices an essential part of running the emergency room. Thank you for watching this episode of Medical Dilemma. Catch us again next Sunday at 6 p.m. here on GNN. You can also watch us every Monday from 11 a.m. to 12 noon on this same channel. Help patients and families in crisis. Be aware and show you care. Have a productive week ahead of you.
Medical Dilemma